Welcome to the second episode of the Expert series by Magic Shop. So, for the uninitiated, Magic Shop is a mental health service which aims to create awareness about mental health. By initiating conversations surrounding mental health, we try to debunk stigmas surrounding mental illnesses and at the same time provide a space for people to nurture their mental well being. So, we've started with something called the Expert series, where we engage in insightful conversations with experts from diverse fields. The entire idea behind doing this is to bridge the gap between these different fields and the aspect of psychological well-being. So, in today's episode, we are really happy to have with us Dr. Sharan Mirchandani. So, born and raised in Dubai, Dr. Sharan moved to India to pursue his BBS from KMC Manipal, and he's currently pursuing his residency in pediatrics from St. Barnabas Hospital. And along with a passion for medicine and working with children, he considers himself to be a huge foodie and movie buff. So thank you so much for joining in, and we're really happy to have you on board for this session.
Thank you, Chachi. Happy to be here. It's been really nice looking at Magic Shop's journey right from the beginning. When you told me that you're setting up something, I was like, "Oh, that's awesome!" Because it's a really nice initiative, especially during these times, and especially now when mental health has become such a priority and such an important topic, which it's been largely ignored. So I'm happy to be here. Thank you for featuring me.
So thank you so much. And so as we know that the last few months have been difficult across various age groups, across the world, and the pandemic has not been easy for any one of us. But with respect to children, I mean, for them, it has been a period of trying to adapt to a constantly changing environment, trying to make sense of a situation that suddenly has everyone staying indoors and adapting to like a new mode of education and lack of peer interaction, and absolute disruption in their daily routine. And along with this, it has also been a phase where a lot of parents and caregivers are concerned with the physical health and physical well-being of their kids. So that's essentially what we will try to look at in today's discussion with Dr. Sharan, how the COVID-19 pandemic has affected the mental as well as the physical children. So my first question to you is, what are some important aspects of a child's physical as well as mental well-being, and how has the pandemic affected that?
So, like you said, it's physical and mental well-being that has been affected during this pandemic. I'll start with physical. So in New York, I deal with a very underserved patient population. So they're from a poorer part of the community in New York. So when I have clinic every week, like no matter what rotation I'm on, and every week I see different. I see around on Wednesdays I see around 7-8 kids throughout the day. And part of it is just for regular physicals, regular child checkups, and some of it is, of course, because they're sick and they wanted to follow up for something, or for vaccinations. So part of a visit involves, it's a good half an hour, 40-minute visit where you go through a whole list of, just ask them, "Oh, how are you? How's everything?" And that's it, you're done. You have to go through a whole list of questions related to. First, you start by kind of addressing their past medical conditions like asthma or any other sort of complaints, and say, "Okay, how's that now? Or your allergies, are they under control?" Then you go to the whole review of systems where you talk about diet, you talk about sleep, you talk about whether they're going to the bathroom okay, whether they're getting enough activity. So I've noticed a lot of the times under the diet section, we've got a lot of subcategories. We have to ask them about junk food, sodas, juices, and what about whether they get fruits and vegetables, So a lot of the times, a lot of them end up saying, "No, I drink a lot of juice, I drink a lot of sodas." And that's only just because everything's so cheap here. Like junk food is so cheap in the US. So it's more easily available. And if it's at home, then children are going to snack. And there's another subcategory under where we have to ask them about physical activity, where we have to go like, "Oh, have you been getting enough activity? Have you been going out? Or have you not been going out at all?" But And now during the pandemic, of course, that question, we've got to approach it differently.
Mm.
Earlier, you would just ask a kid, oh, have you been like going out a lot? Do you play a lot? But now I'm just like, okay, I know that during the pandemic, you haven't been able to get out of the house much, but is there any way you've been getting some activity? So the way we approach that question has totally changed. Earlier, it was just be like, oh, you've been exercising, you've been playing, you play a sport. Now, I start by saying, I know you've been stuck at home, but is there any
Mm.
way you've been going out? So some of them say, yeah, I go with my parents, I go with my mother to the grocery, I go shopping. So I do go once or twice a week, and that gives me that little bit of a
Mm.
walk. But apart from that, a lot of them just say no, like there's nothing I can do. I can't meet my friends, I can't play soccer, I can't play basketball, I can't go to the park, so that's something that's been that's been like, it's been a huge change during the pandemic. Some of them say like now in New York that things have opened up compared to the other states, and I think the rest of compared to India as well.
Mm.
People are going out more often now, and schools have also opened. So now, in the last maybe 2 weeks, they said, okay, yes, I go and play basketball. But when I joined in July, August, and the first half of September, a lot of them have said, no, I don't get out of the house. How do I get physical activity? And then there's a section where we look at their growth chart, because at every visit we measure their height, weight, and BMI, and then your other vital signs. A lot of them present with obesity,
Mm.
which is also because, again, they haven't been able to get a lot of physical activity. They haven't been able to get out of the house. So it's not
Right.
something they can really control. And their eating habits, they can try and cut down on snacking. But like I said, if it's at home and you have nothing to do,
Mm.
you're going to want a snack. So yes, obesity has really like a lot of the times on the growth charts, their weight has just shot like we plot it on a curve, and then it's always like one child's in fact shot up, some of them have like, but no one's actually in the same or like gone down, because these are matters not really under their these are kind of matters that
Mm.
are out of their control. So it has taken a toll on the physical well-being of children for sure, like definitely.
Right, right. I mean, that's absolutely, understandable, because I think it's just been so difficult. So much that's not, I mean, in their control with respect to going out and like just adjusting to everything, at home and stuff. So we've also seen how, globally there has been a spike in cases of abuse and violence towards children. So what do you have to say about that?
So I've read about that too. I've heard about that too. About increased cases of child abuse, because it's a vicious cycle. It's
Hmm.
people are getting frustrated and they're taking it out on their poor children who really don't have a say. And it's just the frustration of being at home, which, and then that's not like, you can't take it out on your kids. There are other
Of
ways to
course.
cope. But I personally don't think I've seen cases of child abuse or suspected child abuse. I mean, there was probably maybe one case I had to sort of report to Child Protective Services because we suspected it. In cases where we really get suspicious, where we look at the child, we see bruising in a weird pattern that is not really consistent with a fall or something, we have to report it. But there was just one case in the last 3.5 months last 3 months that I've had to report. So thankfully, I haven't really seen.
Right.
Um, and when you also about mental health, so physical aspect, child abuse, and now mental health. So a lot of the times when we have to ask children, especially adolescents, children above 12 and above,
Hmm.
we have to there's a separate evaluation. There's like a separate evaluation form. So with adolescents specifically, we have to go through a whole list of different questions. We have to sort of say, so there's something called a HEADS assessment, HEADSS, where we have to go to, it's an acronym for, you have to do, say, home, education, activity, drug use, sexual activity, sleep. So you have to sort of, I mean, you having done clinical psychology, probably know that in that age group, there are certain
Hmm.
like things you have to go through. So what we start off by saying, okay, you know what, we tell them, we're like, okay, we ask their parents to step out.
Right.
Like normally most of them come with their mother or their father or both. So we ask their parents to step out and we talk to them alone.
Hmm.
And we tell them, like in the beginning, that okay, you know what, we're going to ask you a few questions, and whatever you tell us stays confidential, and this stays between us. And we're not going to tell your mother or father this unless we feel that you're at risk for harm or others are at risk. Like if
Hmm.
they've ever thought of hurting themselves or hurting
Right.
others, uh, it's going to, one second.
No problem.
Um, the thing with, so you ask them questions, right? You say, okay, is everything okay at home? Do you feel safe at home?
Hmm.
How's everything at school? Your peer relationships, and activity. What do you do to kind of relax? Then you ask them what habits, drug use, alcohol, cigarette smoking, and then you ask them have they been sexually active, protection, stuff like that. And also you have to ask them. So you add on. You can also add on by saying, okay, is your sleep okay? Have you been sleeping well? And then the last question which you have to ask is, have you ever thought of hurting yourself or
Hmm.
hurting others? Which is of course
Right.
very important, because there have been a few cases over here, especially where we see people ingest tablets and get
Hmm.
admitted. So a lot of the times, I've seen some great kids who have been like, no, we're good. You know, most of them have been like fine and stuff. But then a lot of them just say, and also when you ask them about peer relationships and everything at school, again, now because of this pandemic, you have to tailor your questions.
Right.
You have to
Right.
sort of be like, oh, have you got to meet your friends? And okay, school, virtual, how's it been? So, you know,
Hmm.
if you go like, how have you been feeling? You ask them, some people say, how's your mood? So I just go like, oh, how have you been feeling? You doing okay? You know, tell me whatever is on your mind. And a lot of them just say, yeah, I'm okay. I don't know, like I've just been feeling weird or I've been feeling low. And I'm like, that's understandable. You've been stuck at home. You have nothing to do. I mean,
Hmm.
you know, like you can't meet your friends, you can't go out, you don't know what's happening. Like, you know, the world's going crazy. So a lot of it, it has taken a toll, like, and it has had such a bad impact because a lot of them, again, some of them, and on the other aspect, some of them like virtual classes because they feel like they don't have to go to school and deal with bullying.
Hmm.
Some of them don't like it because they don't get to meet people, like they're in front of a screen all day. Um, and you know, it has taken a huge toll on them. It's been really bad. Some of them have to deal with their parents fighting, or if they come from broken homes, they have to
Yeah.
sort of see that, and it has a really bad impact on them seeing their parents like that. I don't know, complicated family situations, you know. So a few cases have been like that. Well, I never had someone say, yes, I thought of harming myself, thankfully, of course, because that would be an emergency, that would be reportable, and then they've got to
Hmm.
be supervised and admitted. That's a different story. But a lot of them do say, yeah, I'm feeling okay. I get frustrated easily, you know. So some of them have just been like, yeah, I'm okay. You know, I get to
Hmm.
spend time with my parents. I get to help out, you know, like so that's I'm like, that's really refreshing. That's really nice, you know, that's nice to see. And I'm like, that's good. I know it's been
Hmm.
a crazy time. It's not easy for you. I'm glad you're doing okay. And now that schools have opened up here,
Right.
so you have the choice of either going in person or virtual or a mix of both. So a lot of them are like, no, I'm excited to go back to school. I'm excited to kind of get out of the house, meet my
Hmm.
friends, do things, you know. So that's something that's been nice. And uh, so yeah, that's basically the impact it's had on mental health in
Right.
children.
That's really interesting to know, like how you feel like tailor all your questions, like with respect to the situation outside, and it has been different for like the experiences that kids have had over the last few months. I think it's so important that parents, caregivers, family members are also like equally aware that health might be affecting them. The situation is also affecting the mental well-being of their kids, because I think a lot of times people don't take that into consideration very seriously. Like this is impacting kids as well. So thank you for that explanation. So now moving on to like really understanding how if at all a child is detected with COVID, what are some measures that parents and caregivers can take at that point in time?
So again, if a child has been found to have COVID in the hospital, you're supposed to admit them and isolate them.
Right, right.
So, and that honestly is not much your parents can do because, um, I mean, it's a health emergency. It's
Hmm.
reportable to the Department of Health. And there's not much they can do because they can't really go and see their kids as well, because
Hmm.
their kids have to be admitted, their kids have to be in isolation for 14 days, like no matter, and no matter what. And different hospitals have different policies. So here, even if the child tests positive, after the child tests positive, some people say it'll be isolated for 14 days after the first positive test date. And so, and then you kind of repeat testing maybe every, I don't know, every 2 days, 3 days. It just really depends on the provider or on the hospital. But
Hmm.
again, there's not much parents can do because they can't see their child, they can't spend time with their child,
Right.
and their child also is stuck in a room. Like,
Hmm.
it's crazy. Like, it's not easy. So they're kind of really, really helpless. But if, again, another, like, it's kind of diverting, if parents know that their child, or they've been in contact with someone
Hmm.
suspected to have COVID,
Right.
like one of their cousins is sick or
Hmm.
something like that,
Hmm.
when they go and meet people. So what they can do is, I mean, if they want to get their child tested, they can, and they, like, they usually do them at urgent care centers, or they can, there's free testing all over the state, I think. So they can get them tested, or just choose to kind of wait it out. I mean, I'm not, but it is reportable if most parents really rush if they feel their child's presenting with
Right.
COVID like symptoms, because parents, honestly, of course, their main concern is their child,
Hmm.
and with themselves, they're just like, I'll wait it out for a couple of days. But the first sign of illness in that child, like a fever, rush to the ED, because,
Hmm.
so they're more vigilant. But again, there's not much they can do because your child is going to
Right.
be isolated.
Hmm. So,
Yeah.
do COVID symptoms like manifest differently in children as?
Okay, so that is something that's really been talked about. So COVID in children initially can present with similar symptoms, like your fever, shortness of breath, dry cough, fatigue, stuff like that. But also there's something that we've seen, and then there have been case reports of really, really different sort of, I mean, children present with rashes, and
Hmm.
then there's been something, I think, you've got a skin change in your toe or something, the very atypical stuff. But also there's something called multi-system inflammatory syndrome, which is called MISC.
Right.
So it's basically, it presents very differently. It multi-system, like different organ systems are involved. So you have, in addition to fever, you've got a lot of abdominal, like gastrointestinal symptoms, abdominal
Okay.
pain. You can have nausea, vomiting, diarrhea, a lot of diarrhea, and so adults don't normally present with a rash, but children can present with a rash, and children also can have heart involvement equally
Okay.
in multi-system inflammatory syndrome. And basically that is a worrying sort of
Hmm.
sign, because like you have different organ systems that are involved. So you obviously want to be vigilant and make sure that you catch that. So basically, some of the symptoms of multi-system inflammatory syndrome is, you have a lot of fevers. Again, in adults, you will not necessarily have vomiting, abdominal pain, diarrhea, but in
Hmm.
kids, that's very common. Like more than 60% of children can have
Oh,
gastrointestinal symptoms. Again, a rash. I mean, anywhere from maybe 50 to 75% of children can have a rash.
okay.
Eye involvement, conjunctivitis. They can have headaches, confusion. And again, sore throat is not that common in multi-system
Okay.
inflammatory syndrome, so you might miss that out. And if you don't detect it early, it can progress to, shock. And yeah, that's something you definitely want to catch.
Hmm. Right. So there were also like instances, I think in India and a few other countries where kids with COVID-19 were showing symptoms which were like, I think, similar to the Kawasaki disease. So could you like shed some light on that?
Okay. So with COVID and COVID MISC and Kawasaki's,
Hmm.
there are a lot of, like, there have been a few differences according to case studies, because again,
Right.
like Kawasaki's presents with fever, rash, and a really irritable child, and eye changes and stuff, which can present COVID as well.
Hmm.
But some of the differences mainly would be Kawasaki's usually affects young kids.
Okay.
Kids less than 5 years old, it's very typical. MISC, multi-system inflammatory syndrome caused by COVID, can affect older children as well and adolescents.
Okay.
Then in terms of patient population, Kawasaki is very common in children of Asian descent,
Hmm.
but MISC can affect African American, Hispanic children much more.
Right.
And Kawasaki's normally present, like, we have very classic findings of Kawasaki's. You have fever, you have a rash, you
Hmm.
have eye changes, you can have swollen lymph nodes, you can have like skin changes in your hands and feet, and a child's going to be very, very irritable. But in COVID, you have more abdominal pain or nausea, vomiting, or diarrhea. So your gastrointestinal symptoms are way more common in MISC COVID. Then, so Kawasaki's disease, a known complication is coronary artery aneurysm, so your heart problems. But that's a late complication of Kawasaki.
Okay.
But in COVID, that can present earlier, and shock can present more earlier and more commonly in
Hmm.
COVID. Then you have when you think about lab testing, when you're sending levels, when you're getting blood tests, there's inflammatory markers, which there's like CRP, there's something called ferritin, there's something called D-dimer, which are used as markers for inflammation. That's when you know that something inflammatory is happening in your body. That's way more elevated in COVID,
Right.
you know. And so those are some of the differences. So
Hmm.
they've got a lot of they've got algorithms for MISC. You can be like, oh, does the child meet criteria for Kawasaki's disease? No. Yes. So it's like you said, it can be a similar sort of case presentation.
Wow. Okay. Thanks so much for really just clarifying that, because I think it was in the news a while back, and I think there was always a little confusion about what is exactly. So I think moving on to our next question, which I think is our viewers, is what are some strategies to the physical and mental well-being for kids during these times? So what are some tips for parents and caregivers with respect to their physical health as well as mental health?
So I think physical health I'm going to start with, because that's just something that can apply to everyone, to be honest. Because a lot of people just sort of say, yeah, no, I mean, I can't go out. How do I exercise? And I kind of tell them, you know what, there are home workouts, because that's something I did when I was back home. And gyms were closed. So, and home workouts, I know it's not the real deal. You want to go to a gym, you want to feel like you're exercising with people, you're more motivated. But also, you can kind of turn on something on the TV or the iPad, or like a YouTube video, like something like Zumba or do stuff like that, and make your kids do it with you. So that way, the whole family is involved. You're doing something together. And that's actually that will sort of really help with mental and physical well-being, because it's a stress buster. You're doing, like, if the parents and the kids kind of in the evening get together and do like a Zumba class, or like they're doing home like exercises, they're jumping around, they're running around, like, I know there's also limited space at home for a lot of people, so it's not easy. But that's something that they can do. Um, Also, I mean, you can go out of the house for a walk around. Just try and do that as much as possible. Or let's say you want to go grocery shopping, you can use that as like an opportunity to take your child out. So those are some things that they can do in terms of physical well-being, and also like food. I know a junk food is way cheaper, and sometimes because of limited financial sort of resources, you're going to want to get something that's cheaper. But also, just, I mean, you can try and stock, because a child's going to eat what's at home. You can't, if you tell the child stop snacking, if he's hungry and there are chips at home, you're going to eat that. So parents can also try and, let's say, buy more fruits and veggies, or get change up that, like, low fat milk, buy less juice, because juice is really high in sugar and kids love juice. Stuff like, you can get fresh juice, fruits, veggies, stuff, and just keep that at home so your child can snack on that. Something healthier. Like, I mean, that's something they can do. Mental health, in terms of that, it's actually a very, very tough situation for everyone, for parents as well as children, because parents, it's also changed in adults, because you're working from home.
True.
You're always worried about whether your child's okay, whether, like, okay, you got to check on them while you're in a meeting. So they can sort of try and maybe kind of sit with their kids, and just be like, okay, what's up? Tell me how you're feeling. I'm glad that we're getting this time together. Tell me what's going on in your head. Let's deal with this. Let's maybe kind of work on your homework together. So stuff like small things can sort of try and I mean, these are just some things that can be done because it's a crazy situation and
Right.
there's a lot more going on. But yeah, I'm just hoping that things get better.
Exactly, and I think it really brings respect to like getting exercise, some sort of physical activity, so important, along with eating habits. I think that's something for like everyone because again, staying at home and the situation itself, and I think for kids again, having that space with your parents, so probably just having a conversation with your child and probably like I think even maybe inculcating a sort of a routine in their day-to-day life so that because again there's online mode of studying, so there's a disruption of their daily routine. So maybe parents could, I think, incorporate a day-to-day routine of sorts, like wake up in the morning, attend your online class, and like so I think that sort of just regulates their everyday pattern. So I think those are like a few things which I think parents and caregivers could sort of keep in mind. And I think our last question is a really general one, but what are some of like the common myths associated with, a child's health and, you know, like common myths basically?
So a lot of times, something that's really common that you see here is some parents, now it's getting less common nowadays, parents who don't believe in vaccines.
Oh, wow,
That's
okay.
something that pediatricians have to deal with. They're called anti-vaxxers. We call them
Hey.
anti-vaxxers. Yeah, so that's something that's really common. I don't know about India, but in the US, it's not, I mean, I wouldn't say it's very common, but that's something that pediatricians have to deal with. So some parents, there was a study in the 70s or the 80s, um, which wherein someone reported that there was an increased risk of autism with vaccines. I think specifically the MMR vaccine, and that one study was later defunded. It was later proved that it was incorrect. It wasn't validated. It wasn't scientifically proven. And the doctor who worked on it, I think his license was revoked, and that study was, But then that study, like people don't know that, like that it was disproved. Parents still talk about there was a study done that showed increased risk of vaccines with, or like that my child can have autism if he gets vaccinated.
Right.
So we kind of have to try and tell them that no, listen, that study was
Hmm.
disproven. There were so many more studies after that, large scale studies, epidemiological studies that have proved that there is no association between autism and vaccines.
Hmm.
So we see that a few times, and if parents refuse it, we have to make them document it. Like, listen, like your child is unvaccinated. He can sort of spread disease to his classmates. And some schools now make it mandatory for parents to get their children vaccinated. They're like, we don't want your child spreading illness.
Hmm.
So we won't allow you to join our school if you're not vaccinated. So that's something that's good. And a lot of people also refuse the flu vaccine. Every season, the influenza vaccination, I've seen a lot of
Right.
parents just say, no, my child doesn't need it. He's never been sick. I mean, I don't get the flu. He doesn't get the flu. So that's something we see. Also, I'm trying to think common myths, child's health. I think in India also there's a lot of fake news that's been spreading about COVID, especially on WhatsApp.
Yeah,
Uh,
that is.
that's a different, like that's a totally different topic to deal with. But I mean, yeah. So these are some of the things that we see um in children.
Right. Wow. I had no idea that this was actually a thing that
Oh yeah.
parents vaccines for their kids. But wow, that's actually very interesting to know. But so I think that brings us to the end of today's session. And I think we've got a good amount of information about how the situation has affected kids and a few strategies parents and caregivers can incorporate with respect to physical activity, exercising, dietary changes, also maybe incorporating a regular routine. And I think one more really important bit that I would like to add is I think the consumption of news, because there's constantly a lot of conversation about the virus and, watching the news for that matter. I think that can be really overwhelming for kids and, if there's already a lot of fear and anxiety in the atmosphere around. So I think regulating the consumption of also be another, I think, an essential step that parents can take. So thank you so much, Dr. Sharan, for really, agreeing to be a part of the session today. And if any of our viewers have any questions related to this episode, you can just drop us a message or maybe comment below, and we'll try to address it. So, thank you again for being a part of.
Thank you, Saji.
And we shall see you all in the next episode. So.
Thank you.